cancer alone. Today we reaffirm the World Health Organization unwavering commitment to ensuring that no one faces breast cancer alone. Our shared mission is to accelerate access to early detection, timely diagnosis, and comprehensive treatment with the audacious aim of reducing mortality by 2.5% each year through the integration of breast cancer services into universal health coverage. We must close the stark survival gap between high income to low to middle income countries by empowering patients and communities, strengthening health system and embedding breast cancer care in public facilities and essential uh, health system and embedding healthcare in public health facilities and essential health packages. Early detection saves lives through culturally sensitive screening and self awareness, while regular screening, especially for women over 40 and most notably over 50 years of age, save even more lives where available. By elevating data, expanding access, and elevating patients' voice in policy discussions, we can build a system that supports every person's dignity, rights, and future. Together, as governments, civil society, UN partners, communities, and youth, we must act with urgency and solidarity. Our priorities for the next few years include scaling national screening programs with clear criteria, expanding diagnostic and treatment capacity, and strengthening cancer registries and data governance to track progress and accountability. We will champion a holistic approach that includes psychosocial support, palliative care, and survivorship services, ensuring affordable medicines and technologies while reducing financial hardship for patients through multi-sectoral partnerships. By integrating services into the universal health coverage and engaging people with live experiences in policy discussions, we advance into a world where early detection is routine, treatment is timely and high quality, and survival disparities shrink to zero. Let us commit to speed, equity, and collective actions, knowing that with science, compassion, and collaboration, a future where breast cancer is detected early, treated effectively, and prevented where possible is within the reach. Thank you so much.